joining us online. The meeting is being recorded. For those of you who are joining us online, please remember to keep your microphone muted so that we can minimize the background noises. We do want to encourage your participation. So if you have any comments or questions, you can use the raise your hand feature. For those of you in person here, just raise your hand and before you speak, please share your name and your organization so that we know who we're speaking to. And I will turn this over to Karina to welcome everyone.
Thank you so much, Wendy. Really thrilled to have you. And I want to thank you as well as the other team members from the Health Equity and Racial Justice Office. We undoubtedly would not be able to host this forum without the full support of those within our PERJ office, as well as support from our Office of Assessment and Planning. I hope you enjoyed the unveiling of the video at the start of the forum, featuring our very own health officer, Dr. Tony Gedden. And we're just kicking off a Just Health Voices series. It's a new series featuring health equity champions, just like Dr. Gedden and you, all of you, who are just sharing their personal reflections on what is health equity and why it's so important. So I hope it was inspiring to you and that you're encouraged to perhaps participate in this Just Health Voices series. We'd love to feature you. I definitely want to thank the Office of Communications because it was certainly a partnership. I'm looking over to our director of the Office of Communications, Megan Pringle, who was very instrumental in putting together today's video. We do have more for you, and I hope you'll come back to the next Health Equity Forum to check out another health equity champion right here in Anne Arundel County. And as I said, if you are interested in lifting your voice on this topic, you can reach out to us at healthequity@aacounty.org. So our theme today is back to school. And certainly I just personally am feeling the back to school excitement. My household was bustling as I was getting my kindergartner and second grader off to school. And so they were very enthusiastic, little tears sprinkled in because they certainly do not want summer fun to come to an end. But nonetheless, we are in back to school season. And if you don't have a household like mine, it's okay, because the information that we are sharing today is all about how health impacts one's ability to thrive in school. And so joining me, we have many different speakers today. And I encourage you to take out your devices and scan the QR code for the biographies of all of our speakers today.
Oh, that's a show.
Come on, join us at the table. There's plenty of room. Thank you.
I apologize for my height.
You're fine. You're fine. You're fine. We have a lineup of fantastic speakers. In fact, our first one is a friend to the forum, our director of the Bureau of Disease Prevention and Management. She's going to give us an update on back to school immunization clinics.
Awesome. Thank you. Sorry, I'm not able to be with you guys today. So my name is Jennifer Schneider. I am as Karina said, the director of the Bureau of Disease Prevention and Management. And in my bureau, I have the Immunization Services Program, as well as the Healthy Communities Program. We start early in the summer to get folks or get students ready for back to school. So we partnered with Anne Arundel County Public Schools, and we offered a couple of about 6 in-school vaccine clinics this summer. we were able to we were able to provide 265 vaccines to kids in 6 schools. That was our 7th grade vaccine initiative. And I do have some slides that I added to the deck. I don't know if you want to
Yes.
pull them up. Okay. So AACPS is a really great partner. Our partnership really strengthened during the COVID pandemic, when we were able to work with the schools to provide COVID vaccines in the schools. That's one of our most popular spots of places of access is the community schools. So in addition to our community clinics, so those were school-based clinics that were in the community during the school or during the summer, excuse me. We also provide all vaccines at our 2 health centers. One is the Glen Burnie Health Center that's located in Glen Burnie, and the Parole Health Center that's in Annapolis. Each of the health centers are open different days of the week, so that we're able to provide vaccines, or we're able to provide public health services different areas of the county. And right now our big push is back to school vaccines. So right now the team is working extremely hard to provide all childhood immunizations required for school. And so that has been going on for the past couple of weeks. So folks can call, and make an appointment, or they can simply walk in. In addition to school vaccines, they also do TB testing. And so that is also needed for some students coming into the school system. So those are also provided. So you'll see that our Glen Burnie Health Center is open Tuesdays, Thursdays, and every other Friday, and Parole is open Monday, Wednesday, and every other Friday. And our goal, just to expand that access, is to open both health centers 5 days a week. So both health centers will be open Monday through Friday. We're also exploring options to work outside of business hours. So doing some evening clinics and doing like a Saturday clinic, again, just to increase, people's options to ensure that everybody gets the vaccines and the services that they need. So if you go to the next slide. So new to our, menu of locations is the Lula G. Scott Community Center, starting on, which is in Shadyside. So, hopefully serving the South County part of the county. Starting August 16th, we started to offer the same services that we offer at the Glen Burnie and Parole Health Centers are now being offered every Wednesday from 9:30 to 3:30. So again, it's childhood immunizations that are required for school-age children. In addition to that TB testing, there's other services that we do offer. But since we're just focusing on school-based stuff, I just wanted to highlight that today. Again, people can call for an appointment, or they can just walk in. Since we're only open 1 day a week, we are encouraging people, if they do want to make an appointment, or if they have any questions about Lula G. Scott, just to call the Glen Burnie Health Center or the Parole Health Center for that. So we're super excited about being able to bring our services to the residents of South County. So you go to the next slide. So these were the back to school vaccine clinics that that the team is working really hard on right now. These are evening and Saturday morning clinics. We have two left for this week. So we have one tonight from 4 to 7, and then Glen Burnie on 8/31, 4 to 7 p.m. So hopefully these are very, very popular so far. We've seen a little bit over 330 students and provided almost 900 vaccines. So Karen, who will speak a little bit later, who's the director for school health services, might know our non-compliance rate. But students that are not compliant with their required school vaccinations are supposed to be excluded from school. So we really offer more options for parents and guardians that bring their children in, just because we want to make sure that the students stay in school and are able to stay in school. And so again, this flyer is available. This information is available on our website if anybody wants to share that information out. Like I said, we have 2 more, and these are walk-in only. You can get any vaccine. It's not just the 7th grade vaccines. Kindergarten vaccines, if there's new students to the area that are new to Anne Arundel County Public Schools, they can come in, even if they don't have a vaccine record from the United States. We will take care of everybody that walks in. And so new this year, we did offer these expanded hours last year. New to this year, we were open on both health centers on Saturdays. And then also new, a little bit different this year, we're partnering with School Health Services at Anne Arundel County Public Schools to offer in-school flu vaccine. So during the school day, we are going to be offering flu mist to students the week of October 23rd. We're going to be targeting the Title I, Kerwin, and special centers. Flu mist injectable flu will be available at the special centers, and we're doing both the first dose and the second dose if there's any students who this is their first flu vaccine. So we're really excited about that. We partnered with them before the COVID pandemic, so we're really excited to bring this service to the students. And again, we want to keep them in school. We want to prevent those respiratory diseases. So we're really excited about that. And then, as always, we all are still offering COVID vaccines if anybody is not up to date on their COVID vaccine. So thank you. That's it.
Thank you so much, Jennifer. Really do appreciate that overview. Now we're going to segue to talking about school health services, and I want to briefly introduce our next 2 speakers. And again, you can scan the QR code for more information. Aisha Austin has served as the Assistant Director of Nursing for the Anne Arundel County Department of Health School Health and Support Program since 2013. In her capacity, she assists in providing professional nursing oversight and guidance to a workforce consisting of over 300 nursing professionals, supervisory, clerical, and health services support personnel. Karen Siska Creel has served as the Director of Nursing for the School Health Program in Anne Arundel County since 2011. She has worked in the field of school nursing for over 22 years. In her capacity, she collaborates daily with local school system central office staff to coordinate efforts to remove health-related barriers to education and provide high-quality nursing care in the school setting. So at this time, I'd like to turn your attention to our next 2 speakers.
Hi, thank you very much. We appreciate it. We love the opportunity here to talk about school health and what we do. School health started many, many years ago. We are governed by state and federal laws. We cover from birth to 21 years old. It really came about when it started with the Section 504 Rehabilitation Act of 1973. This allowed individuals with disability an equal right and access. Now, within that is FAPE, which is free appropriate public education. And then after that, 2 years later, came the Educating Children with Disabilities Act, which is now called Individuals with Disabilities Education Act. And under there is FAPE as well. Now, it basically says any child who has a disability has equal access to his or her education. Not only that, it went a little further to say it has to be in the least restrictive environment as possible. They have to be able to be educated with non-disabled students, just like disabled students. So, and then down in 1991, several years later, the standards for school health were developed. Soon after, Anne Arundel County started our program in 1992. And we started it, you can go ahead and flip the slide. We started it was actually a piloted program. Oh, well, here, actually, let me cover this one first. What happened before the law? What happened before the law changed is students with disabilities actually were educated in 3 of the special centers, which we still have right now. But it was a non-boarding school setting. They were community-based. It did provide a great education for them, focused on independent learning. But it was really, and they had OT, PT, nursing services, but it was educating primarily with disabled and not with any peer. So flip over here, so I was getting ahead of myself a little bit. The start of school health, in 1992, it was a piloted program that was over 7 schools, and we had 5 nurses and 7 health assistants. And the program actually started with $250,000. That was it. Now the program is about an $18 million budget to run it. And where we are today is the next slide, is that we have over 100 school nurses, almost about 140 health assistants, LPNs, we have student aides, we have some children who literally require door-to-door services. So the LPN goes, meets the child at the home, rides the school bus, attends school, and then rides the bus back home with the child. We have substitute staff, we have on-call staff, and this is spread around the 128 different schools. Next slide. So our model is every high school and middle school has their own health assistant and their own nurse. Now in elementary schools, what we've done, we have 1 nurse over 2 small elementary schools. Now the schools that we call Kerwin schools, but the school system calls community schools, that changed our little model a little bit with the elementary schools. Now we have 1 nurse and 1 health assistant in each of those community or Kerwin schools, so that we can really focus on the needs of the students and the community and within those schools. We also have health assistants in every school. We have part-time staff. We have, as I said, one-on-one aides with the students. Now the model, our next slide. School nursing is very different than hospital nursing. And whenever we interview nurses, we always tell them this is very different. You are not practicing nursing in a hospital or in a medical setting. You are practicing in an educational setting with completely different language, different acronyms. It's very, very different. It is a specialized practice where we really focus on protecting and promoting the health of the child so that they develop, have the optimal development, and then they succeed academically. So go ahead. Now, when you look at it nationally, what percentage of the population have chronic health conditions? 40%. When you look at behavioral learning, obesity, you look at asthma, you look at diabetes, everything that could possibly impact a child's ability to learn, 40%. Now in Anne Arundel County, which is the next slide, we focus it down to just have a medical condition that we can impact. And you're looking at 25%. So those are the children that we provide direct services to. Go ahead, next slide. Now, evidence has shown that the health and the academic achievements of a child are directly related to, you have health or health is related to lack of education and to poverty. It is this cycle that goes around and around. So the next slide. So we look at the social determinants of health. There's several of them here, but we're in school health looking at the health access and the lack of education and what impact can we do. And prior to this was way years ago, we met with the school system and we had said, if we could look at the children that are not doing well, cross-check that with and cross-reference that to the children who have chronic health conditions, then we can identify those children who maybe are falling behind that we can help. The next slide. And that really the goal of that is to, if we can eliminate their health barriers to them accessing their education, we can help them succeed. Go ahead, the next one. And that's the goal. And their health barriers and why it impacts their learning is A, they're not even available. It has indirect and direct impacts on it. They're not available for their learning. It has sensory perception. They're seeing, hearing. And it's cognitive, they're executive functioning for remembering, focusing on it. And then the other pure fact that they're not even in school. They're too sick to come. The next slide. So that comes down, as I was saying, that looking at eliminating what we were years ago, the achievement gap is really the opportunity gap, because healthier students do well in school. It's giving them ability to learn and be successful, and then they can carry that on to the rest of their life. The next slide. So the role of the school nurse really is a multidiscipline kind of team approach where we're looking at health, public health, and primary care. So we work with families, we work with physicians, we work with the educational world to make this all and kind of bridge the gap. We will go to home visits, go to doctor's visits, whatever we can to try to help address those issues and those barriers, to address them and help eliminate them. So we can kind of just bridge that gap between health, wellness, and education and learning. Go ahead. So as I said, we provide direct care services, and we also try to promote the health of the child and in the community that we work and we serve.
Okay, thank you. And so as Karen explained so nicely, school nursing is a specialty within the field of nursing. And what school nurses do is they bring their knowledge, skills, judgment, and experience. We don't hire school nurses right out of nursing school. We require them to have a year, 2 years of experience. And then what we ask them to do is to bring all of that knowledge, judgment, experience, and training with them to school health. And so they're going to use their expertise to identify, assess, plan, and implement, and evaluate the health needs of the student. And so contrary to popular belief, we are not reactive in school health. We're proactive. We don't sit in the health suite and wait for sick children to come in. We are assessing the school community from before the first day of school. Happy first day of school, everybody. So we are looking at the registration forms that parents are bringing in. Does the student have their immunization? Do they have their physical for school? If not, if they haven't had their physical, why? What are the barriers to that? And how can we link them to care? Whether they need a primary care doctor, do they need help getting insurance? Do they need low cost or no cost resources? So that is our role, to identify, assess, then plan and implement. We're doing nursing assessments and health appraisals. We're looking at the emergency cards that parents are filling out. Are they identifying that their student has a health concern? And then we're reaching out to that parent before their child even steps foot in the health room to talk with them about about their child's diagnosis, about the care that they've received, and any treatments, medications, or services that they might need in school to access their education. Next slide. And so with advances in healthcare and medical technology, we know that children are born sicker, younger, and they're surviving and they're thriving. And so caring for chronic conditions and illnesses can be complex and continuous. And it is the role of our school nurses and our health staff to provide that daily management, but also addressing any emergencies that might arise. And so this is just an overview of chronic health conditions that we saw in our health rooms during the 22-23 school year. And so as you can see, we have students with anaphylaxis, asthma, diabetes type 1 and type 2, seizure disorders, health conditions, mental health is definitely on the rise. And then other chronic health conditions like cardiac conditions, metabolic conditions, respiratory conditions other than asthma, like cystic fibrosis. So that was just kind of an overview of what we're seeing in our health rooms and what our school nurses and health staff are working with students and families every day. So a new initiative that we have, and we're so happy that Shannon is here from the school system today, a new initiative that we have for the 23-24 school year in our community schools is a telehealth model. In an effort to increase access to care and to allow students to miss less school time, parents to miss less work time, we're going to have via a telehealth model and teleconferencing. When a student comes into the health room, we're piloting it in 2 community schools this year, starting with 2 community schools. I'm sure we're going to be expanding quickly as soon as we work out the kinks. But we're going to, if a student comes into the health room with a health concern, they're assessed by the school nurse. If they meet the criteria to have a telehealth visit, then we're partnering with Total Health Care, which is a federally qualifying health center. They are going to have a physician available. We're gonna make an appointment for that student in a timely fashion so that they're not missing class time. And then we're going to link the parent and that physician in a telehealth appointment facilitated by the school nurse. We're gonna have Bluetooth enabled assessment equipment. And so then we'll be able to, that student will be able to have a visit, be treated, and potentially have meds prescribed and delivered directly to the student's home. So we're hoping, we are hoping to launch that really soon, and we're so excited about the improved health and the outcomes of our students. Next slide, please. We also know that in our schools, our school nurses spend about 32% of their time providing mental health services. Now, are there mental health providers in the school? Yes, there are school psychologists, there are social workers, there are school counselors. But the need is overwhelming sometimes. And so then our health rooms do end up being an overflow location for those students, whether they might present with some physical symptoms. And so then, stomach aches, headaches, fatigue. And so we're assessing them, determining if there's anything medically or physically wrong, and then providing slight services until we can transition them to their school counselor or the school psychologist or a social worker. So we do manage that in the health room. And then we also are able to work with the school team to identify resources for that student and the family. In regards to crisis intervention, so for the last school year, we did see substance use and abuse in our schools. There was a definite uptick, and there has been since the COVID pandemic, in violence in the schools. So these are visits to our health room. The numbers represent visits to our health room. We have had social emotional visits to our health room, and then unfortunately suicide, ideation, and threat. In regards to substance use prevention, we launched the STAR program in our health rooms in 2018. STAR stands for Screening Teens to Access Recovery. And so what this program does, it's another telehealth model. In the high schools, a student can come to the health room. If they have a substance use issue, if they are wanting to get help and they're seeking help, there's no wrong door. They can come to the health room, and our school nurses can link them to an adolescent and family services here at the health department, a clinician, and they will get a screening. And then based on the results of that screening, they will provide resources and encourage that student to work with their parent, guardian, or another trusted adult to get them linked to care. Last year, we launched it in December 2022 in the middle schools. And due to the expansion of the minor consent law, and so middle school students are linked with a partnership through the school system and Thrive to a clinician. And if they're having issues, if they are vaping and they want to change, if they feel like that they have a substance use issue or concern, then they too can get linked to a clinician, have a screening, and then work with that student's parent or another trusted adult and get them linked to services and care. And in total last year, we had 17 students come to the health room seeking services from the STAR program. Now, realize we launched it in March 2018, and then there was COVID in the midst of that. And so we kind of had to go through a relaunch of that program.
And in total, we've seen 32 students have come into the health room since we started.
Next slide. Opioid awareness and overdose prevention in the schools. We know that whatever is happening in our community is also happening in our schools. And our county, our nation was in an opioid crisis and epidemic. And so what we didn't want to happen was that a student would die at school. And so in all of our health rooms, we have naloxone, which is the overdose reversal medication. And all of our staff are trained in opioid awareness and overdose prevention. Not only are they trained, but they're trained to identify an overdose in the pediatric population, because sometimes that can mimic other health conditions and other health emergencies in our smallest populations. Thank you. And as Jen mentioned earlier in her presentation, we do partner with the school system and with our partners in disease prevention and management to provide flu vaccine in our Title I and community schools. And we will do that again this year, as she stated, on October 23rd. And our numbers increase every year. And so we talk a lot about school health. Our bureau is actually school health and support. So on the support side of things, we do have a birth to 5 nurse who works at the school system and their infants and toddlers and child find program to provide assessment, intervention, and developmental support to increase access to care and ensure school readiness. So these are, this is a program that's available to all Anne Arundel County children and their families with qualifying delays or disabilities. And this nurse's role, so she serves 0 ages birth to 5. She goes to the home. She will assess the child, work with the family, see what needs they have, work with the physician, review reports, go to doctor's appointments, all in the hopes to increase access to care, but also make sure that these children are on the road and ready for school. We also have an audiology program that we partner with the school system again, and this is, our audiology program is for Anne Arundel County Public School students with diagnosed or suspected hearing loss. And so they provide, we have 2 full-time audiologists, and they provide audiological exams, classroom observations. They recommend modifications and accommodations in the classroom, listening devices, sound fields. They provide parent and teacher in-services and education, and then they fit any assistive technology that a student may need, as well as collaborate with providers and find referrals for funding. And then our nationally renowned vision and hearing screening program, as we like to refer to them as, and their role is really early detection and then follow up. So in the public schools, we provide vision and hearing screening at school entry, which could be ECI pre-K or K, 1st grade and 8th grade, but then also from parent referral and teacher requests. So if parents have concerns and they want their student tested, or teachers are seeing things in the classroom and they just want to have a student tested, they can refer. And so they're doing a basic screening. And then if the student passes that screening, those results are sent home. If the student doesn't pass that screening, then they are referred for a comprehensive exam, either by an optometrist or ophthalmologist or an audiologist. And so then once they complete, we complete all of our screenings, and we've set the schedule up this way by the spring. And so then in the spring, we spend only on follow-up. So it's focused follow-up. Who haven't we heard from? We make phone calls, we email, we work with the school teams, we are pulling in the school nurse, what parents, what students didn't pass, and then we haven't heard from their parents that they had an exam and that they received either glasses or a hearing aid that they needed. So we focus that follow-up all spring long. Next slide, please.
And this is always my favorite quote. You can't educate a child who isn't healthy, and you can't keep a child healthy who isn't educated. Thank you.
Thank you.
Thank you to the both of you for that comprehensive overview. you did mention the opportunity gap, and our next speaker will be talking about just that. Dr. Pamela Brown is the Executive Director of the Anne Arundel County Partnership for Children, Youth, and Families, and we're so delighted that she has joined us in person to talk about the Joint Commission on the Opportunity Gap. Before we pivot to Dr. Brown, I do want to acknowledge the presence of our health officer, Dr. Jody Gedden. Thank you so much for joining us today. If you have any questions on any of the topics that we've already addressed, feel free to put them in the chat. We will get to them, or you can email us at healthequity@aacounty.org. Dr. Brown, over to you.
Okay, let's do our slides. Let's get going. I am here only today to talk about the joint initiative to eliminate the opportunity gap, how it started, why it started, and what we've been doing since 2019. I'm usually here with a lot of data. Usually it's all disaggregated. I'm really glad to be here with our school nurses. When I go around and collect data on racial and ethnic inequities, they are usually my best sources of information inside school systems, because they actually talk to and work with the children and families I'm most concerned about and do a fantastic job. So I love the school nurses. They are
We love you too, Pam.
all right, next, let's get going. So why did we start the Joint Commission? Well, it really was to address the persistent disparities in academic performance between white and Black students. It's a very straightforward purpose. It was set by our very straightforward county executive in his very earliest time as the county executive, because he was so horrified by some of the data he saw on how what was happening to both our African American and to some extent our Hispanic students in schools. That is not anything that's just here in the county. That is a national issue. I don't want you to think that this is an Anne Arundel County thing on its own. The difference is that here in the county, we have been struggling with what to do about this for many, many years. So next slide, please. So what did we decide to do? So as is the one of Stuart Pittman, the county executive, he turned to everybody and said, we need an initiative, and it needs to be a joint initiative. We need to get the school system and the county and community and neighborhoods together to talk about this issue. And he created the Joint Initiative on the Achievement Gap back in 2019. And I think, Pastor Cheryl, you were at the first meeting at the school where I did all the data, right? 200 people turned up to the first meeting, real people, community people, not your usual folk, because they were really concerned about what was happening to their kids. I did a big presentation. I disaggregated all the data. I looked at everything. I looked at health. I looked at the environment. I looked at what was happening in early childhood. I looked at diabetes. I looked at everything that could make the difference between a child being unsuccessful and successful. And I will tell you here and now, and nobody knows this better than Dr. Gedden, who talks about it as Dr. Gedden does. Many of these issues start before children are even born. They start with not enough prenatal care and the neighborhoods that children live in. They are the neighborhoods with the worst tree canopy. They don't have enough tree canopy, so it's 15 degrees hotter in those neighborhoods, because believe it or not, we even have inequity in our trees. They have the worst air. They have the most lead in the water at schools. So even before they are born, things are unequal, disparate, not working for those children. So the first 5 years becomes very important. So I talked about all of that at the community launch. We broke up into groups. We created a load of wishes and needs. And then many of those stakeholders said, what we need is an independent commission that will really look at that, look at what's going on. We created 5 subcommittees at that time: curriculum, discipline, family life, social determinants of education, and systemic racism. I was on the systemic racism and the social determinants subcommittee. During that time, when that group was meeting, we changed our name because we'd originally been the Achievement Gap. Because what became very clear to everybody, and what many of us know in our hearts, is that this has got nothing to do with achievement. And if you use that word, you make the suggestion that those children are performing less well because of something to do with them. And so we rechristened it the opportunity gap, because what happens when our children do not get the same opportunities is that they then do not achieve success in life. So we were very focused on opportunity. And we created a written report, which I presented along with 4 of my colleagues to the county executive and the superintendent, and we had 4 recommendations, and here they are. So they were a distillation, they're not here yet. It turns out they're a distillation of all the themes that came out. What we had talked about a lot is the need for a real collaboration between the school system, the county, and the local community. And God bless Shannon, we got community schools. Dr. Pugh came along with community, the word community right there in our schools. We talked about the real need to talk about the structural and systemic contributors to opportunity gaps. The whole notion that much of this is created by historical, systemic racism and bad policy that has been built in the US over many hundreds of years, as you all know. And how are we going to build in any sort of accountability and sustainability for both our neighborhoods, our school system, and our county government? So next slide, please. No joking, here they are. So number 1 priority, establish a coalition of stakeholders. Priority 2, mitigate the effects of social determinants. So they are all of the things that go wrong for our mothers, our babies, and our children that are to do with what is happening where they live. It's about where they live. It's about the lack of all of the good things. And you know, those of you know me, I could talk about that for the rest of the afternoon, and I'm not going to. The notion of really increasing transparency in the school system and the county government, and holding them accountable for some of this stuff. And then really establish a practice of looking at and analyzing equity and what are the policies and decisions that help create inequity, and where are the existing ones, how do we change them, and for new ones, how do we make sure that equity is built? So they were the 4 priority recommendations. Off we go, next slide, please. And some goals. First of all, we had to get the support of the Board of Education and the County Council for our actual recommendations. It wouldn't have been much good if they said, well, we actually don't agree with you. We thought that creating a coalition of stakeholders was really, really important, and I made a big fuss about that at our presentation. And then we said, is there any low-hanging fruit? Is there anything we can start with here that would be a quick win? Where are our goals? Next slide, please. Well, we got Board and County Council support back in 2019. Oh, sorry, in 2021. And I want to tell you guys, all the time this was going on, we were in the middle of a pandemic. And we, the original group of stakeholders, we kept meeting all the way through the pandemic. We never let it go. We kept it going. So by 2021, we were ready to make these recommendations to the Board of Ed and the County Council. And the county executive at that point started to set goals specifically around improving kindergarten readiness. And why? Next slide, please. Well, he had seen some of the data, disaggregated, some of my data. And I hope you can all see it there. If you start looking at kindergarten readiness by race and ethnicity, you start seeing some really awful gaps. Now you can see those gaps all the way up standardized testing. But the pitch I have made always is when children are not ready here, then that gap just widens all the way through school. So really where we should all be concentrated, right, is right back in maternity care, right back in what's happening to a child before it's born, and really focusing on those first 5 years so that when children are ready for school, they're ready. When children are entering school, putting their foot on Dr. Pugh's doorstep, they are equally ready. Somebody else said this, not me, but it's so true. We have one group of children, our African-American children, and to some extent, our Hispanic children, who arrive on that doorstep with the lead boots that we have built for them. In the neighborhoods they live, in the policies that we've created, and in all of the inequities that already happened to them. The other group of kids have got a really nice pair of new Nikes. It's a race, and it starts there, and there's no equal way to run that race. And I think that's one of the best analogies I've ever heard, and I wish it was mine. So I think you can say, I just looked at these actually again. So I've got it all the way up to the most recent scores. I wanted to look at something that gives me this much hope. Like, I don't know what's less than a smidgen of an inch, but it gives me some hope. You will see that back before the pandemic, our overall rates, 46, blacks 34, Hispanics 28, whites 55. Whites are always obviously way ahead of the game. And you can see what happened during the pandemic, and you look how badly our African Americans and our Hispanics dropped during that time. Especially our Hispanics, and I think a lot of that was to do with how difficult it is to do an online environment when you use English as a second language. That's some of that. But now we're looking at our 22-23 scores. You see, everybody is doing a little bit better, but nobody except African Americans are doing better than before the pandemic. And that is my tiny bit of hope that I'm running onto. Because all of the others are still below where they were. But that's the gap, guys. That's where it starts, and it keeps getting bigger. Next slide, please. Back to, so we created, or I didn't create it, the county executive wrote an executive order that was agreed to by the school superintendent. And the reason it's an executive order and it's not inside the school system is we wanted it to be as independent as we could make it. And we wanted that county government and everybody else in the county to realize that this is not the responsibility of the school system to fix. It's already there when they open their doors. It's up to all of us to fix. So here's the county executive's executive order. It said that 6 members will be appointed by the county executive, 6 members by the superintendent, and 3 members appointed by the actual commission once it was seated for a group of 15. And you can see what we said. One has to be a county representative, one with NAACP, faith, life experience of inequities in the county, somebody from an education focused not-for-profit. So they were stewards. And then for the superintendent, we had a youth, an early childhood specialist, a pupil personnel worker. Yay, pupil personnel workers. I love them as much as school nurses. They do a fantastic job. And they really understand what's happening to our kids outside of school and what they then bring into school. A principal from a Title I school and someone from the Discipline Advisory Committee. And so we started meeting at the end of 2021. Next slide, please. And I volunteered to be one of the staff people because I just couldn't let go of it. And Jen Purcell from the county executive office was the other staff person. And then all of the people who had worked with us, like the head of the equity office of both the county and the school system, eventually joined us. So we formed a committee structure based on what had been recommended by the original committees that worked over that 2 years. One was social determinants, one was data and transparency, and one was equity. And we got our additional members appointed. So we were quite sort of impressed that we got that going. We knew exactly what we wanted to look at. We got all that. Next slide, please. So the first year and a half was really for the commission to learn. We did workshops on the equity lens so that we could all really understand what we mean by creating policies with an equity lens. We talked about results-based accountability. Remember all of that stuff about how we're going to hold ourselves and everyone else accountable. We looked at kindergarten readiness at every level of why children are not ready for school. We looked at the equity initiatives already in AACPS and the gaps. We were fascinated by the blueprint for education and what it was going to do for our kids. Dr. Pugh and Community School is a regular visitor. I think she spends more time with us sometimes than she does in the school system. And we looked a lot at the social determinants of education. Then we started to think about outreach. We just finished developing a fact document. We made presentations to the school board and the county council, and we're just about to release a whole load of sound bites on social media about why kindergarten readiness particularly is so important and what everybody can do about it. Parents, neighbors, family, what you can do to help our kids get ready. One of the things that had happened by this point is that the council executive has set as a goal around readiness. He's still talking about all the readiness statistics, which makes me very happy. His goal is everybody gets to 76 by 26. So we've got 2 years to get everybody to 76%. Low hanging fruit, we've got something in the budget that kindergarten readiness would be the focus in libraries. There's a whole new kindergarten readiness programming in all of our libraries now. We did an inventory of 0 to 5 programs. We got the equity officers to become part of the commission. And then we started doing crossover between the Opportunity Gap Commission and the Early Childhood Coalition. And we are doing a summit in a month's time, all about the importance of creating childcare for our children who are most vulnerable and most needed. We've joined in the advocacy related to superintendent search for schools. And in the last 2 budgets, we have done advocacy and letter writing to express our priorities for spending related to addressing the opportunity gap. Next slide, please. There is loads more to do. This year, we're going to be focusing on disaggregating and sharing data with the community. We sort of took a breath because the data was so difficult during pandemic. Schools weren't in session, they were not collecting data. I wasn't collecting data in the same way. The census went to bits during that period of time. So we're now getting back to a place where we can look at pandemic data and the first year after the pandemic. It's quite interesting. We're really going to be focusing on race and ethnicity and what's happening with those groups post-pandemic. We need to develop a stronger community presence. We have not done that. People don't know about us enough. We need to continue our advocacy for budget dollars, especially now. Why now? Because we are facing my vulnerable neighborhoods that are disproportionately African American and Hispanic are facing what we call a federal cliff. That means that all of the money we used during the pandemic to help vulnerable families is going or has gone away. So that advocacy for budget becomes way more important. We'll be meeting with the superintendent and county executive at year end. The superintendent will be coming to our December meeting. And the importance of having the equity officers is we've got to start really looking at policies for review around equity. And that's all institutions. This is not just a schools event. Every single institution needs to be really starting to look at policies with an equity lens. The next slide, please. And here we are. You can see our little faces. Peggy Cruz, who is actually the director of, I'm going to get a title wrong here. The director of Family Health Services at the Health Department is also the chair of the Joint Commission on the Opportunity Gap. And it's such a beautiful juxtaposition because obviously as a family health, public health person, Peggy Cruz understands way better than I do the inequities in health, the inequities in neighborhood, and the inequities across the board that get us where we are in terms of the opportunity gap. We are doing a changeover at the moment. Some of the first terms are coming to an end, so we're getting some new commission members on the council, which is why I didn't list them. But they have been a very hard-working council. They have been a very frustrated council. These are some of the things that we were looking at around. This is a brainstorming on readiness scores. We did what we call a Turner course on readiness scores, and that's their brainstorming on that. I would say after 2.5 years, the biggest feeling is frustration from them that we have not done enough, that we don't work fast enough, that we don't see change. And I say to them, I've been working on this for 30 years, and I expect that people will be working on it for 30 years more, because it took us hundreds of years to get here, right? Hundreds of years to get here. And now, this generation, and this time period is the time when we have to start undoing things that were done, things that were set in stone over hundreds of years. And that is long-term work. When you try and tell that to a politician, I mean, every time I say that to the county executive, it looks like, because he says to me, I've only got another 3 years. We have got to get a move on. I understand that. And I understand the need to work as hard as we can. But I want to say to everybody, there ain't no quick fix in there. There just isn't. There's too much damage and too much to do, and it will require all of us. And I will finish now.
Thank you so much, Dr. Brown. So this has been a rich conversation. We're going to continue our discussion. And I'd like to turn it over to Dr. Pugh, who is the Director of Community and School Programming. If we can just impose upon your time another 15 minutes, she will talk about the community schools that Dr. Brown has already intimated at, and will end after she finishes.
Perfect. So in my experience, it's always a really hard task to follow Dr. Brown, but I will do my best. So if you wanted to go ahead, I sent to this slide. There we go. So community schools, sometimes called Kerwin, but we're trying to just focus on community schools as the final term there. Basically, everything that we've heard so far this evening or this afternoon, the community school strategy is about how do we actually integrate all of those needs together, and ideally making the school the hub where a lot of these resources, we can connect families to existing resources. So academics, health, social services, you see the list there. But up in the upper left-hand quadrant, this is our affinity mapping of the different wraparound services. Community schools is funded through the Blueprint for Maryland's Future. And so in there are allowable opportunities to spend some funds, as well as to just focus our work. And so we have physical health, social, emotional, behavioral, 2+ generational supports, and then academic enrichment and attendance. So those are our foci throughout our programming. So next up, so this is how do you become eligible for the community school grant? It is based upon a 3-year average of poverty. It has been a little bit of a moving focus. Really, the pandemic, did a little bit on some of our data related to poverty. So we had 1 year or 2 years where all students received free meals, and then sometimes families turned in forms and didn't turn in forms. So we're kind of working our way through there. And then the latest one last year is Medicaid became a direct certification for farm services. And then we know that we're struggling a little bit to get all of those applications or recertifications back in for there. But right now we have 23 community schools. And then each year you can see it was 80% or above in 2019-20 as far as community school eligibility for the grant. Currently, we're at above 60%. And then next year, which is the final threshold, which is above 55%. So I was talking over here, I anticipate maybe 11 schools next year being added. So we will see how that works out. But how that divides up around the county, the next slide has a little map. We are primarily in Annapolis, North County, Meade, Glen Burnie is going to be the next area that we have a lot of growth. So I do anticipate perhaps 2 locations in South County, but since our neighborhoods are very much drawn along historical factors related to poverty, I don't see too many community schools being in some of the other areas of the county. So if you'll keep going. So what are these wraparound services? On the left, I did a little bit of just numbers, the numbers game. We do pay for 23 full-time community school program managers. Their job is to be the facilitators and the coordinators of our community school strategy within our schools. We heard about the nurses, so we have 23 full-time school nurses. Some of those are funded through the community schools funding, others, of course, are county funded. So it's a great partnership there. We were able to start a dental program for our grade 3 students. So they actually get a dental checkup, the sealant, the fluoride application. So that's going to be in 18 schools this coming up year. If they have 3rd grade, they're having that program. 9 full-time social workers. For elementary school especially, we do not have a whole lot of social workers at all in the county and never really have. And so being able to, in year 3 and above, in many of our schools, be able to pay for a full-time social worker is proving to be extremely valuable. We also have help with behavioral teaching assistants. Our psychologists in our schools are not full-time. They are split between at least 2 locations. So in at least 6 of our in 6 of our schools, we're using the funding to make that one psychologist there the entire time. So they're not splitting their time with others and can dedicate to one community. A few other behavioral supports, we're able to working very much with the county governments. So in Parks and Recs, we've blended and braided some grant funds for 5 aftercare. Subsidized sites, the county was paying for 3. And so we came in and was able to add some community school funds there to expand that. We have some bilingual specialists, some additional counselors. And then we already heard about the telehealth, which a great thank you to all the individuals to my left over here who did a lot of that work because there was a lot of language there. It wasn't my language. So luckily the people next to me were able to work through some of those. I'm not going to read everything over on the right, but a lot of opportunities related to health, related to education for the adults and the families. Going into Dr. Brand's talking about kindergarten readiness, we've really been trying to focus on some toddler opportunities. So getting children who are not yet in our schools into our schools for toddler story time and some other things with their parents, I think has been really crucial. We have at least 2 sites. We talk about, we have a group of children now who have never not had a community school to go to since they've been born. So it's been some type of opportunity for them, and then lots of opportunities for kids with field trips and other excursions. So just looking at that strategy of providing wraparound services to try to what I call disrupt some of those social determinants of health and well-being and academic achievement is really the goal of a really amazing group of community school program managers. So didn't know if anyone had any questions, certainly could do that, but I know we're running short on time. So, but very excited about our efforts and our partnership with the Department of Health and many things. So
I want to thank all of our speakers. I do want to leave space if there are any questions in the chat or in the room. We have time for.
I did have a question. We had someone in the community looking for, I think that was Jen that was on there. Do they know if like the AAA transportation would provide services to those sites for vaccines?
That is a good question.
They should provide it with these to the health center.
Yeah,
They should. But we can double check.
we will capture that question. Thank you, and get back to you.
I have a quick question. The community schools, are all of them going to be, but I know Annapolis Middle was just added on, so I'm really excited about that. Are the schools providing like the backpack buddies at the community schools to all of those community schools? That piece is a concern for me.
So almost all of our schools already have some type of partnership. They are actually able to use some grant funds to enhance that a little bit. You're talking about the Friday backpack
Yes.
programs, yeah. So my understanding, at least from them, is that they already have some type of partnership to provide some of the basics, but they can enhance it through the grant. That makes sense. We can talk about any specific concerns we have. I'd love to break that down a little bit.
There's one question on the chat.
Okay, and this will be our final question. How does the Community Schools Initiative coordinate with the Strengthening Families Program?
So not as well as we should. We do have a couple of community school locations who are sites for some of the strengthening families, which I believe is through the health department. So I know that's happening in 2 schools. It's coming up, but it's certainly a great opportunity to expand those opportunities there for those families.
All right. Well, we have lots of events coming your way. We will be sharing these slides, so you'll be able to take a look at them. Again, because we are over time, I do want to give just a tremendous thanks to all of our speakers. Thank you so much for coming today and talking about back to school. We will be joining you again next month for our next Health Equity Forum. Thank you so much for joining today's Health Equity Forum.
Right.
Thank you.
Thank you.